Newton Vardy is not here, so I've been charged to carry this on now. So this is one in a series of our academic training environment presentations, and we are privileged to have Dr. Walters here to facilitate this session. As you can see, the topic is on team-based learning, principles and practices. There's even a subtitle which states how you can teach a basic science course with no lectures. So that's good. So it's very interesting. So before we start, it's good to have some brief background on Eric. So he had his BS from University of Wisconsin-Madison in pharmacy at that time. And then went on to University of Kansas, where he obtained a PhD in medicinal chemistry. He did his postdoctoral work at Indiana University, and from there he was employed in the food and pharmaceutical industry, and eventually became, in the process, an expert on the biological chemical properties of pseudonyms. So in his current role is the Associate Dean for Research of the Pharmacy and a professor, and has been awarded the Rosalind Franklin Teaching Award.
And then you get introduced William?
So
he did all that without notes. I'm very impressed.
Thank you.
Yeah, so I've been here a long time. Way before there was a College of Pharmacy here. I taught in the biochemistry department for a number of years. So the first question is why do you want to do something like team-based learning? And this is just an example of from the literature. This was actually a meta-analysis of 225 studies about learning methodologies and outcomes, comparing lecture-based versus active learning teaching methods, and the graphs basically show that active learning behaves better than lecture-based formats. Here you see a lower failure rate in active learning formats than in lecture-based, and similar kind of results showing. So, here we go. So the interesting thing I took away from this paper was that they actually question whether lecture ought to be the control format for that we consider the standard in teaching now, since so many studies show that active learning is better. And I'm sure you've seen the Bloom's taxonomy of learning, and the point here is that lecture formats sometimes get bogged down here in just remembering facts. A good lecture will get you into understanding the material and maybe even see how to apply it. And the team-based learning format tends to get you higher up into this application phase of learning more often. And that's what I really like about it. So the example that I'm working from is medicinal chemistry. I took medicinal chemistry more than 40 years ago. And in the old days, we memorized a lot of chemical structures. We just did. And so you see morphine there. I actually had to memorize the structure of morphine, and I used to be able to draw it from memory. I couldn't do that anymore. But when I see that sort of skeleton of carbon atoms there, I recognize that it's an opioid. I see that and I know. The other one that I've shown over here, apalutamide, this one was approved by the FDA last December. And the reason I show that is that nowadays, there's no point in memorizing drug structure. My students can find the structure faster than I can. The point is, what do you do once you find that structure? How do you use that information? And so what I want my students to do at the end of the day is not memorize a ton of structures. I want them to be able to look at a new structure that comes out down the road after I've taught them, years after I've taught them, and be able to see if there are, for instance, ionizable functional groups that might affect the solubility of the drug, so you have some idea how to formulate it into a liquid formulation, or get it into an IV or something like that. This particular drug, I've already taught hundreds of pharmacy students medicinal chemistry, and I never showed them that structure. So I want them to be able to look at a new structure and make some sensible inference about the properties of the drug. The team-based learning thing, when we were first setting up the College of Pharmacy, before we ever had any students on board, we brought in a seminar speaker who told us about team-based learning. And he had been using team-based learning in a College of Pharmacy. Team-based learning was actually developed by a professor of management at the University of Oklahoma, a fellow named Larry Michelson. He did this in his management courses, and he wrote books about it. I've got a couple of examples here. One's the original book about his team-based learning format, and one that people have put together dealing specifically with health professions education. So it's been adapted to a lot of different kinds of subject matter. The way that it works is sort of a formula. And the first step in the formula is the pre-class reading assignment. And it's not just a read chapter 3 reading assignment. It's supposed to be specific and focused, and tells the students exactly what factual stuff they're supposed to know by the time they get to class. And part of it is just setting expectations. Here's what I want you to accomplish before you ever get to class. Now I have a 2-hour block of time once a week for my course, and so 2 hours is a good chunk of time to carry out this kind of format. The first thing that happens when they get to class, they take a quiz. It's not called a quiz, it's called the Individual Readiness Assessment Test, or the IRAT, but it's a quiz. Basically, they're not allowed to use notes or books or anything like that. It's designed to ensure that they will come prepared, because the quiz counts for their grade. It does assess whether or not they got that factual component that you wanted them to get, and it also makes sure they show up. Since it counts for the grade, if you skip more than a couple of weeks of class, your grade will suffer. Yeah.
Do students do this automatically? They go to the old-fashioned system that we grew up in to be able to do this?
Part of what I will tell you is that it takes them a few weeks to get up and running and get into the format.
So not a few years?
No. By week 3, everybody is up to speed and on board, and works pretty smoothly.
How much does the quiz count?
I'll show you the rating scheme here a little later on. It's significant.
Okay.
Yeah. So this is students in my class working on the individual quiz. You can see they're using their laptops and doing this with Examsoft, Examplify, or whatever it's called these days. So they take this 10-question quiz. It doesn't take very long. And immediately after that, they take a team quiz, the Team Readiness Assessment Test, or TRAT. Again, they can't use books or notes. They work together on the same quiz that they took as an individual. So it's the exact same quiz, but now they have to work together to answer all the questions. What happens there is if it's an easy question and everybody knows it, they pick the right answer and move on. If it's something where there's some uncertainty about the concept, if somebody's not clear on it, they talk about it. So they spend their time talking about the things that they should be spending time talking about, getting everybody up to speed.
And there's one of you with how many student groups?
So I do this in a class of 60 to 70. I feel like I could comfortably do this with up to 100 by myself. I've seen Mike Fenwell do it with 200, and he usually has somebody else in the room helping him out. So
does he do team-based or Quickers?
He He has, I've seen him do team problem solving. Yeah, so it's not this exact format, but he does have them spend a whole session working together on problems and then walking around the room with a microphone and asking a team what.
And while they're doing the quiz as a group, are you walking around?
I do walk around. That's part of the fun. I get to hear the comments and find out what one of the things that they need to figure out. What are they struggling with? What do they already know?
Will they ask you?
They may ask, but when they're taking the quiz, since the counselor agreed, I don't answer their questions until after the quiz is complete.
Is it a multiple choice or is it?
Yeah, it's multiple choice.
Could you fill in blank as well?
Could. It would be more tedious to grade.
Yeah.
Yeah, but you could certainly do it that way.
So yours are just all multiple choice.
Mine are multiple choice, and you'll see some example questions, and you'll see why. For this particular subject matter, multiple choice works pretty well. So here they are doing the TRAT. They're talking with each other. It's fun to see the contrast because when they're taking the IRAT quiz, the room is quiet. And then once this starts, it's just a buzz, and people are talking and discussing, and you get to hear the discussions and find out which students really know their stuff, and you get to see them explain it to somebody else. So there's a lot of peer teaching that goes on at this phase of the process, and this version of the quiz can take 10, maybe 15 minutes. I don't rush them because they are talking with each other and teaching chemistry to each other, and so this is an important piece of the process.
Is the individual quiz timed?
I typically don't time it. I walk around the room and I can tell when people are done or near done, and typically what I do is I say how many people need more time. If it's a lot of people, I'll add a few more minutes. If it's a couple of people, I'll say 1 more minute.
Yeah.
So I sort of play it by ear, and literally by ear, I listen to what's going on in the room and see how people are doing with it. Some topics, they have to work a little harder at than others, and so sometimes the quiz takes longer, sometimes it goes pretty quickly. For the team quiz, we use these scratch-off cards, sort of like lottery cards, where you have to scratch off what you think is the right answer. And so they get a couple of things happen here. They get instant feedback. So as soon as they agree on an answer, scratch off what they think is the correct answer, they know immediately if they got it right or not. So here's an example where if you look at question number 5 here, they've scratched off E, nothing under that, so that was the wrong answer. So now they have to talk about why was that the wrong answer. And sometimes they find out that somebody knew something but wasn't speaking up. Sometimes they find out the guy that's talking the loudest doesn't know the most. So they sort of get to a point where they learn how everybody's functioning on this team, and they learn to draw out the people.
How many people on each team?
5 people per team.
Is that a magic number?
I've done it with 4 to 6, and that's a good size team to get everybody participating. If the teams get bigger than that, it's easier for somebody to sort of sit back and do nothing.
Do the teams stay the same?
Yep, the team stays together for the whole course. I feel like I can talk about my algorithm for how I divide them into teams. So here they tried D, and that also was a wrong answer. Finally, they got B. B was the correct answer. You see the little star there, got uncovered. So that's how they know which is the correct answer. So they get immediate feedback. They know as soon as they take the quiz whether they got it or not. And this is also part of the fun. When they get to the scratching off answers, you can hear them all cheer if they got it right, or you go either, oh, why was that wrong? So there's a scoring scheme that goes with this. If they get on the first try, they get 5 points for the question. They get partial credit for knowing something, right? So if they get it on the second try, they get 3 points and on down the line. So on this particular quiz, this team got 41 points. So for the team component, everybody on the team gets that score. And that also counts towards the grade. So there you can see somebody scratching the answer off the card there, and everybody's watching to see whether it's going to be right or not. After the quizzes, I take a short break, 5 minutes. And, yeah.
Do you take the same one next year, or do you change this from year to year?
Oh, the quizzes? I change my quizzes every year. They're, again, the topic I'm teaching.
Probably leak out. So.
Yeah, well, my subject matter, it's so easy to change a quiz. I'll show you some sample questions and you'll see why. But at this point, I do take a 5-minute break. A couple of things happen during this break. I encourage them, if they think I wrote an ambiguous question, write an appeal as a team. And I consider those appeals seriously. And when people take the time to write one, it's about a 50% success rate. Once in a while, I can write a bad question or an ambiguous question. What that does is it gets them to go back and look at the textbook and see. I thought this. Let me go back and check it in the textbook. So again, things that they need help with, they go back and look at it again. During that time, I look at those quiz cards and see, is there a particular question or 2 questions that cause a lot of trouble for people? Is there a concept that needs to be clarified? Is there something that really wasn't clear from the textbook? After the break, if I need to, I will lecture for a couple of minutes just to clarify a point. Not the PowerPoint, just use the little doc cam thing here if I need to, so it's my chance to make sure everybody is up to speed with the factual stuff. I take questions. If anybody has any questions on the material before we move on, that's the time to deal with it. And then we spend the rest of our time, over an hour of that 2-hour block, solving problems. During the problem solving, I let them use books, notes, online resources. I integrate material from other courses that I know that they should know to make the problems interesting. When I'm going around the room discussing the answers to these questions, I ask them, where did you find the information? If it's Dr. Google or Dr. Wikipedia, they get the big eye roll from me, and they learn pretty quickly that I want them to use reliable sources. What actually happens in the problem solving is that they have to apply that factual stuff to solve a clinical problem. So they see, why are we learning all this chemistry? How's that going to help a patient? And that's really a real key to this whole process. So here they are solving problems. You can see they've got a couple of books and a laptop open. They're discussing the problem that I've given them. So every team is working on the same problem. And at some point, the problems have multiple choice answers, A, B, C, D, or E. All at once, each team has to pick an answer, hold up their answer. So I can look around the room and I can see immediately, this one was a pretty straightforward problem. Most people picked C, somebody in the back picked B, but this one was a pretty straightforward problem. So then I walk around the room with the microphone and I say, all right, why did you guys select C? How did you rule out D or E, which might have been pretty good distractors? Where did you find your information? I can ask people with B, why did you like the answer B? And again, where did you find your information to support that answer? Yeah.
So I have a question.
Yes.
So in some specialties like pharmacology and microbiology, they're very clinically oriented.
Yeah.
It's not a big leap.
Mm-hmm.
Whereas if you take a course like embryology, it's the clinical applications. We just looked at all the slides in embryology, for example.
Yeah.
Number one, the amount of information is pretty overwhelming in a given lecture. So one, how would that be? How do you decide what information you want the students to focus on, number one.
Yeah.
If you have 50 slides and each slide has 10 points, that's 500 points. How do you decide the important ones for them to focus on, number one? Number two, like writing a clinical case that would bring in those points is not so easy.
Exactly. Yeah.
So
This is something that I had to figure out for myself. I know the chemistry, but how is that going to be used in practice? I had to go and talk to my pharmacy practice colleagues and say, how do you actually use pKa values of drugs? How does that play into actually helping a patient somewhere down the road? So I needed to sort of think beyond my area of expertise and try to find out how is that factual information going to get used? Because there are hundreds and hundreds of drug structures and lots of things you can infer about those drug structures, but what do you do with that information? How does it ultimately help a patient? That's where those of us who are basic science people really need to be able to sit down and talk with somebody who's a clinician. So I would assume you had to talk to somebody who actually uses that embryology information somewhere out there in a clinical setting. I have no idea who does that or how they do it, but that's what I would have to do is find somebody who is a clinician who uses this sort of information. How do you use it? What's the point of learning those 500 slides or whatever they are? What does that do for somebody in practice? I don't know.
So then there's the dilemma of the clinician might say, well, I need 10 of those 500 points.
Yeah.
And the scientist might say, no, to understand that you need 500, and to pass step one, you need 100.
Yes.
So how do you deal with this?
So what I attempt to do is at least expose them to maybe the 100, but have them work through examples that use those 10 or whatever the number is as illustrative examples of the concept. But having seen how those other pieces fit, even if they're not going to remember those 100 2 years from now.
In your prep lecture before class, you will include more information, but when you do this problem solving, you try to zero in on those 10 key points.
Yeah, so the textbook,
Clinical.
so the textbook has got a fairly comprehensive description of stuff. I may tell them to focus on the 100, and then when I'm quizzing them, I might quiz them on the 10 that are most important.
I'm curious, Gordon, is this possible at our school?
Well, so that's the question I have. So what is the ratio of the time they have to put in number of hours before they actually come here in order to know the subject?
Yeah. So
Do they have, farm lectures are very highly organized.
Oh yeah.
And in an hour, we basically cover the whole topic and be given the information that we think they need to know.
Yeah.
They would have to learn this by themselves. It would take 10 hours. Now, do they have that time before they come to you where you reinforce what you want to reinforce?
Yeah, so I'm giving them the reading assignment a week ahead of time. This is for a 2-credit course, so it's 2 hours per week worth of credit. I would guess that some of them can learn what they need in half an hour, and some of them probably have to spend 2 hours outside class before they come.
The question would then be, how many of these exercises can they actually do in a week? Because they have to learn a lot. I mean, this is not the only
Right,
lecture that they
exactly,
get.
yeah,
So do
yeah.
they have 10 hours for only, I don't know, 15 hours that they have to learn?
Yeah, and that's a fair question. I'm aware of the concern there. I will say that in pharmacy, I'm the only one that does this team-based learning format as the sole delivery vehicle for the whole course. There's a certain amount of lecturing of that, but there's some certain amount of other kinds of active learning methodology going on. Yeah.
And kind of along those lines, alluded to, it takes a couple of weeks to train them in the
Yeah.
group, but then you feel like they actually are doing pre-reading.
Yeah, after a couple of weeks.
So if they get embarrassed in front of their friends the first week or two, then they start to actually.
Yeah. Yeah.
So I'm concerned about that too.
Oh, yeah.
I mean, it was, so when we think about doing team-based learning, I think we're talking about the clinical cases.
Yeah.
I think that's where
But-
it is.
Yes.
But this is something different. This is everything.
This is science. Yeah. So I'm trying to get them to know sort of the basic factual pieces before they get to class, and then in class we're figuring out how to use that factual stuff to put it together with other stuff you should know by now to do some useful.
Using this in a way, because we're using our Friday cases in roughly this format. We're giving them that quiz and then sending them into a case discussion. Based on what was presented
Right.
and they learned that week.
So basically, it's a reinforcement with what they have learned.
Right.
And
So,
I mean, when we start the small groups in the farm, and I think it's done with Blue Cross, and initially the idea was that in small groups we would place lunches, and we very quickly realized it's not possible. For the reason that I stated before. So what we do is in small groups we reinforce certain topics, so we come back to them, and that works very well.
Yeah.
But we still have to lecture them before to organize the knowledge that they need to know in a really reasonable number of minutes or hours,
Sure.
as opposed to let them do it themselves.
if you do this, you have to be very careful as the course director, faculty member, to target the information that you want them to know.
Oh, yeah.
And to reinforce it.
Mhm. Yeah.
I'm guessing there's a lot of work setting it up, making sure that it's appropriate, making sure
Sure.
you have good problem solving.
Yeah.
A lot of it is prep work beforehand. on your
Yeah.
part.
Yeah, so this is just another example of everybody holding up their answers. This one illustrates what happens. You can see there's some A's and B's and C's and D's scattered around the room there. Part of the fun of this approach is that you can write a clinical case that doesn't have a single best answer. In real life, sometimes there's not a single best answer, and you can maybe trade off one possible drug interaction against some possible side effect or some other issues. And so you can write cases where there are 2 or even 3 pretty good answers, and none of those answers is perfect. And when you walk around the room with a microphone, you start asking people, why did you pick this answer? Now you get some discussion going on about these pros and cons of different aspects of the science, and they have to think about a little more deeply and wrestle with it. And I'm always trying to get students to wrestle with the material. I think the more they do that, the better it sticks. So
When you give them reading assignments, do you give them like modules to watch, a chapter to read, or do you give them questions to find answers to?
I've got an example of a reading assignment coming up here in the next slide. So this is just an example of one topic that I have to get them to figure out, and that's the idea about a drug molecule ionizing, existing in a neutral form or the ionized form. And that's important in part because the ionized form is going to be a lot more water soluble, so if you're trying to get something in an IV bag, you're better off getting it into the ionized state. Also, when you have a big hydrophobic molecule with a negative charge and a big hydrophobic molecule with a positive charge, you put those together in an IV bag, they're going to precipitate. So that's just a chemical principle that they have to understand and then be able to apply when they see 2 drugs getting put into the same IV bag. Is that a good idea? So here's my reading assignment for the week where we covered this topic. Let's see. So first, I do sometimes put additional materials online. The tutorial that I talk about up there is one that I actually prepared for the medical biochem course when I was teaching there. It's just a set of PowerPoints that lead you through the principles of acids and bases and how they work. And I did record about a 5-minute mini lecture that sort of talks students through a couple of examples so they can see this without sitting through a whole entire lecture. So if there's a point that I think will benefit from having 5-minute video, I do that.
So how did you decide what information to include from, let's say you had a lecture on this.
Yeah.
Is everything you said in the lecture, the tutorial, the mini lecture, and the chapter? Or did you decide what to include and what not to include?
I do some picking and choosing. The main principles, I want those to get the main principles of the week's topic. I'm not going to be recording an encyclopedic recitation of all that.
So, like, if you compare this to like the lecture you gave on the topic before you did this,
Yeah.
what percentage of information would you say you eliminated from the lecture?
Well, so here I've got 5 minutes of actual lecture. The other material that I would have lectured has been put out there in the format of a set of PowerPoints that they can read through with notes. And then the textbook, which is pretty typical textbook presentation of So
is it the same amount of content or half the content?
It's
quote standard lecture you might have given?
I will say that the content's all there somewhere. It may not be organized in the same way that I would organize if I were lecturing it. I might do it in a different way, but basically I do sometimes give them supplemental materials to work with. I tell them to read Chapter 3, but I also tell them which pages to focus on, what part of that chapter is the most important. Here I included a particular functional group that the textbook left out that I thought was important.
I mean, I like this. One of the criticisms that we've heard is that does this mean we're going to an online medical school?
Yeah.
Which I disagree with, but that's
Yeah.
a concern.
Yeah.
How would you answer that?
They have to show every week in class to do the problem solving and take the quizzes, or else they're not going to pass the board. So I highlight one of the things you absolutely need to know when you show up. I've got some extra verbiage there to clarify that I don't want them memorizing the exact pKa values of different functional groups, but I want them to know at physiological pH, is this going to have a negative charge, be neutral, and have a positive charge. So they don't need to memorize the exact pKa to figure that out. And also, I do another particular thing that I want them to understand. I highlight that. I do make them look at a few structures, some really important ones. So I think pharmacists ought to recognize opioid analgesics when they see them. I think they need to recognize a beta-lactam antibiotic. Some of those basic. So each week I give them 5 structures, and I say I want you to be able to recognize which is which. I don't expect you to draw structures for me, but if you see a particular structure, I want you to be able to
How
put
do
it.
you choose it? I mean, it seems fairly arbitrary.
It's arbitrary, but it's not. So here I'm talking about acidic and basic functionality. So I picked 5 drugs that have examples of acidic and basic groups. Here I included a couple of opioids just because I think that structure is something they should recognize. I've got a few really common drugs, ibuprofen and aspirin. They should know those. And I tell them I want them to know for each of those drugs what are the ionizable groups. So they get used to looking at chemical structures and being able to spot those particular functional groups. That's the point of the session. So I give them 5 examples that I want them to spend some time focusing on. So I want them to recognize structures, be able to tell the five apart in a lineup, and understand the ionizability of each.
And can you teach those of us who have just given, the 50-slide PowerPoint lectures with 10 points each to do it a different way? I mean, at what point in someone's career can they just not do it a different way?
So I started doing this.
You can.
I had taught in the medical school for 18 years,
Yeah.
lecturing in the big auditorium, when I started doing this.
So, I'm just asking, I guess I'm asking, is it that people won't do it or they can't do it?
There's a certain amount of work involved. In particular, putting together all the materials that you need to pull this off every week. So I was lucky. When I did this, I was building a course from scratch. I didn't have to take a whole bunch of lectures that I had spent years preparing and convert them all over into a new format. It would have been the same amount of work to make all of this into lectures as to make all of this into team-based learning. So lucky me, I did it at the right time. And
It seems to me, and I may be wrong, if you teach a principle, which you do, I can see how you do this. But if you teach content, for example, I'm teaching antidepressants in an hour, okay?
yeah.
Everything, all that I need to know about antidepressants, which is basically memorizing facts in terms of what drug
Yeah.
classes you have, what are the drug interactions, what are the side effects, how the principle works, stuff like that. That just seems more difficult to do in a reasonable amount of time compared to, meaning if they have to work that up by themselves. Again, how many hours do they need to get it, as opposed to I present it to them in an hour. So
But
what's the ratio?
If you had a recorded lecture, let's say broken up into, where you present different classes in 15 minutes, they can listen to that on their own. And
Sure.
That's a little
That-
bit
yes.
easier to
Okay.
work than just
That-
reading
that's-
something.
Right, okay. So they would read they would look at the recorded lecture, where they get the information, but how is this different from coming to a lecture and interactively discussing?
Well, then
there's
when they
more time
come
to discuss.
Then when they come to school, when they actually have to show up, then it's more
Reinforce.
So is that kosher to give them the pre-class assignment as a recorded lecture? Or does that go against the grain?
Well, you do that with the
I do little short lectures.
snippets.
Yeah, I don't record an entire
Snippet.
45, 50-minute lecture, but
You could do a combo maybe of snippets and readings, right?
yeah, you could do that.
Where they get
Sure.
most of the information.
Because I agree with the cardiac drugs. I think it would be hard for them to just sit down and read the chapter of Goodman and Gilman and come away knowing what's going on,
Right.
what's important.
Yeah, some textbooks are more readable than others.
Yeah. So I
Some are encyclopedia.
try to highlight the key points
Right.
and limit how many
That's
adverse
what I heard in
effects.
the lecture.
But if they could listen to that and then come in and then we would just go work through a case, like the small group cases, I don't know.
Yeah.
That would work. I don't know.
Yeah, I mean, the kinds of problems, I'll show you an example of a problem too, but the whole idea of having a problem that a group of students can work on and then discuss, that can work in a lot of different formats. It doesn't have to be team-based learning, but just trademark, something like that. So this is just an example of quiz questions, and the thing that I like about my quiz questions, you can see the first question there, I'm asking them to identify a functional group in the molecule. Next year, I can put that same question and just plug in a different drug structure. Right? I have hundreds of drug structures.
One year it's ME, another year it's quantity.
Yeah. So my content lends itself to writing new questions every year. It's so simple. I just cut and paste these structures in. But here, the bottom questions, you can see I've given them a set of 5 structures to choose from, and they have to analyze the structures and tell me which one has 2 ionizable groups instead of just 1. So they do have to do a little analysis. It's not just like memorize, okay, morphine has 2 and codeine only has 1. I can put different structures up there, and they have to analyze each structure, and they have to recognize the building blocks.
Eric, what do students say in terms of if they prefer the old way or the new way?
The first year I did this, I had a group of students form a committee and come to my office and petition me to go back to lecturing because I was such a good lecturer, and they had never heard me lecture. These were first-year students who had never heard me lecture, so there were in the beginning some students who had never experienced this kind of teaching style before and were uncomfortable with it.
Was it representative of the whole class, or was this just
This
one little
was-
cohort that...
This was, I don't know how big a group they represented, but it was a significant
Yeah.
number, and they even went to the dean and asked him.
And you listened politely and
And
said,
said, no, we're going to do this
keep
way.
doing this?
And I just have one more question. So,
No.
my understanding is that this is more fun for students and that it's aligned with how we think people learn.
Yeah, yeah.
But there's sort of a paucity of evidence to prove that this is better than what I did, several decades ago.
Well, that PNAS paper,
Right, there's one.
it's a meta-analysis of
So
225
what do you
sites.
say to scientists who don't want to change, they want it the old way, they say there's no proof this is better? What do you say?
Show them the evidence that it,
It's sort of bad.
scientifically, it's been shown to be better in 225 different studies. I understand that it's not necessarily the...
No, I'm just playing devil's
Yeah,
advocate.
no,
That's what people are asking
That's
us.
fine. And some people probably would do this very badly, and those people probably should stick to lecturing. I don't know. I think there's enough variety in people that we have to... We want to accommodate a lot of different learning styles, but we also have to accommodate different teaching styles.
That is a big issue, because if somebody's not willing to do this, they're not going to do
Yeah.
a very good job at it either.
Exactly. Yeah. Yeah.
Of course.
Yeah. So this is an example of one of my clinical problems. So here we've got a 78-year-old man who's got painful osteoarthritis, and his pain has recently gotten worse, and he's, let's see, got some medical history on him. He's been a lifelong smoker and has emphysema. He's currently taking a few different drugs there. This poor old man has always had difficulty swallowing pills, so the physician usually has his oral medications formulated as syrups. And so the physician has called you up and asked you to advise on what should we do about this guy's pain getting worse. And so there's a couple of choices with morphine buffered to 2 different pHs. Obviously, one of those would be wrong, and one is correct. The last 3 are different COX-2 inhibitors formulated in different ways. And so my course is not about which analgesic is the best one for them to pick. They can do some research on that in the course of solving this problem, and that's fine. I'm less concerned about which analgesic they pick than for whichever one they pick, how they decide to formulate it. That's the real principle. So they will spend some time looking at the structures of all 3 of those different drugs, looking at the acid-base properties, and deciding, can you dissolve it in a syrup? Is it something that's so insoluble you'll have to make it into suspension? I know that they've already learned about syrups and suspensions in pharmaceutics in the fall quarter, so I can incorporate that. And so they have to spend some time researching and deciding what's the best choice here. Because this is not a pharmacotherapy course, I have to be open to either going with an opiate analgesic or a COX-2 inhibitor. Pros and cons for both of those. Guy's got some respiratory problems, so maybe you wouldn't want to use morphine, but he's got some pretty serious pain, so maybe you need it.
So how do you decide between asking them to discuss the 5 answers versus just an open-ended question? What would you do?
Yeah, so these are first-year students, so they're not at a point where they can go into the whole list of possible analgesics and pick one. So I purposely set it up as multiple choice and given them a few to choose from that I want them to look at. Really, what I want them to do is look at the chemical structure and be able to infer what you have to do to dissolve the drug, or if you can even dissolve the drug. And so they've got some choices. I asked them, all what's your favorite answer, and you see some, typically some A's and C's and E's, or A's and D's and E's. So here, I've got a little discussion about the choice of drugs and the trade-off between the amount of pain relief and the guy's respiratory problems. But whatever drug they choose, they have to get the right pH for their formulation. So the formulation is what I'm really looking for answers for to here. And so I discussed the pK values and how that affects solubility, and they can pick. So, but this is an example of a problem where I had three, A, D, and E were all pretty reasonable choices, depending which drug you chose.
Do the groups get a grade for their answers on this?
No, they get a grade for participating. So as long as they're participating, working at this, and being part of the team, they get credit for having.
So how do you judge that? Make sure that everybody...
Well, I walk around the room, and the two things that I have to watch out for. One is people doing Facebook or Twitter or whatever social media thing that they would do. And if I see that, I say, you're going to participate or else you're not going to get credit for this part of your scoring thing. The other thing that I occasionally see is somebody studying for the pharmaceutics exam that's coming up tomorrow. If I see that, same thing. I warn them once. You need to be focusing on the problem solving or else you can't get credit for this part of the activity today. And really, only once or twice in the last 5 years I've had to give somebody a 0 for not participating. They're pretty good about participating. This is one of the things that happens when you give these drops. A student found out something that I didn't know about paroxetine. If you look in Micromedics, which is a very reliable resource, it tells you don't crush the tablets. It's an enteric coating formula to protect the stomach, and so you shouldn't crush up the tablet and put it into a solution or a suspension. I didn't know that. but these things happen, and so I congratulate the student for finding that extra information that I didn't know. And that's part of the fun. This is my grading scheme. So 70% of the grade comes from individual stuff, the daily quizzes, the individual quizzes, the midterm exam, and the final exam. So if you hate team-based learning, you just show up at the beginning of class each week for the quiz and then go home, and you get 100% on every quiz and exam, you can pass my course, but you get a 70. So it strongly encourages showing up every week and participating. The team components also count. The TRAD scores count. The team problem solving, they get 10% of the grade just for showing up every week and participating. And I have a peer evaluation component, which some people like and some don't. It is what it is. So here's how it works. Each person has to assign 100 points among their teammates, and they can't give any two people the same score. So they can go, 18, 19, 20, 21, and 22, or they can go 10, 15, 20, 25, and 30. I don't care, but you have to give each person a different score. You also have to say one positive thing about each teammate and make one suggestion for improvement for each teammate, stated in a positive way.
This is a written?
This is written, yes. I do this twice in the course, halfway through as a formative exercise, and then at the end as one.
Oh, not
counts.
every time you get together.
No. This happens twice during the course, and the second time it counts for makes up 5% of the grade.
So how much time do you give them to do this?
Oh, they have to do this outside the class.
Oh.
This, filling out the peer evaluation form. they
Get
do that.
together and gang up against
So, first year I did this, Team 10 teamed up, and they all agreed, okay, I'll give you 18, you 19, you 20, you 20. And so everybody got exactly 100 points. And I called up the guy who taught us about team-based learning, and I said, have you ever seen this happen? He said, oh yes, that's a good sign. That's a really highly functioning team. And in fact, it was a very, very good team, a very highly functioning team. And they teamed up and figured out how to figure it out. They figured it out, and that's fine. So that's just an example of the kinds of assessments, or peer evaluation comments that people give. You can imagine. I do look for one positive statement and one constructive suggestion for improvement for each student.
They post that on E12? How do you get that information?
In the past, they've sent it to me in Dropbox, and I've sorted them all out, which is tedious. The IT people have figured out an automated way to do this now. John Becker test drove it earlier this year, and I'm going to try it this year in my course, see how that works. If you've done problem-based learning, you're familiar with this concept of being either a content expert or a facilitator. In this kind of format, I'm a little of both. When I'm preparing the cases, I need to be a content expert or involve some other content experts to help me come up with good cases. But when we're doing discussing the problems, I try really hard to be just a facilitator and let them talk through the issues and work it out. And this is a pretty typical course evaluation for this course. You can see most of the statements you get a strongly agree or unagree, which is a good thing. A couple I want to highlight. There's always 10 or 11% who hate this format. Every year, there's 10 or 11% that hate it, but the rest of them are fine with it once they get used to it. This is one that surprised me and was really gratifying. Course content is relevant to my future profession. I never saw anything like that when I taught in medical school. Biochemistry? Yeah. And course content prepared me for applying clinical principles into practice. I would never have guessed that. So a few frequently asked questions. Can you do just a little bit of it? You can, but it's tricky because it takes a few weeks for the teams to really sort of gel and sort of grasp the concept and figure out how this works. Why am I not doing it today? This is so much better than lecturing. Why didn't I do this whole presentation in a team-based learning format? Because I've seen that done badly. Nobody would do the reading before you came to my talk. Right? You wouldn't have done the reading, so it wouldn't have worked. And can I borrow some of those cards? Sure. I've got a bunch of those cards if you feel like trying to.
Who makes those for you?
That's in your handout there. There's a link to where you can buy them online. So on the 30th, we'll be talking about sort of working through some applications. Hopefully, people show up with topics that they would like to think through how to do this. If we can get some basic science and clinician people together to workshop this a little bit, we can, I think, create some example cases or at least get it started. So, to thank Lane Brunner, who taught me this method. Dr. Waldemariam at Cal North State actually teaches medicinal chemistry in this format and gave me some pointers, and my clinical colleagues, and then especially the class of 2015 college pharmacy, the first group that ever went through this with me and told me what was good and bad about it. There it is, the MedChem Cup. The winning team at the end of the course gets their names engraved on my trophy. It's big and heavy and cheesy. And it's fun. That's it.
So how come you're such a closely guarded secret? Here we are, this new curriculum. I've never heard of you. We're getting people from all over the country.
Yeah. I've been here for 26 years.
Thank you, this was fantastic.
All right, let's give a hand